It's very exciting, yes. No, not too bad. No, it wasn't bad at all. Oh, I didn't have to wait at all. It was very quick. They wanted me to sit and just wait for 15 minutes to make sure everything was okay. I feel fine, the same before I came in, yes. Well, my director, Courtney Ash, she just texted and say, well, they're doing the shots. Would you like to have one? I just said yes. Yes, so that's why. It's just life, everything has its risks. So, I don't know what the risks of it, but, it's a chance I'm willing to take, so. I find that they're more isolated, and they just need somebody to be there at their side and just let them know everything will be just fine. Personally, I don't have a fear at all. No, I haven't. I worked with the first COVID. Well, I worked with when they announced that we had COVID here at the hospital. I was one of the first people to work with that particular patient. So I have not had a fear since I worked with it from day one. I just know to wash my hands and just be careful about what I'm doing. And I tell people everywhere, in the hospital, at home, that's all we can do. Extremely sick, yeah, but that's okay, we have a good system here, so everybody's doing fine. So you just have to try to have them think about something else besides being sick, concentrate on other things. I'm getting it for all of my family and friends. Yeah, so, just everybody that I come in contact with. So just the public. I think it's a game changer, so, I hope more people will get the shot and we can just go from there and see how everything works out.
That's impossible to put into words. It's surreal. This is like the glimmer of hope that we've waited months to feel and to have, and we need it, and I think we're all just super stoked that it's here. For many of us, and I have nurses that have been doing this for 34 years to, this is the first year of their career. These are the sickest patients that we've ever seen. They continuously are getting more and more complex. And their acuity is unlike anything we've experienced. So what this means for my team and our team as a health system is that we may start to feel a reprieve eventually if we just hang in a few more months, keep fighting the good fight. Honestly, I talked to a couple of my staff who work on the front lines with me, and some folks weren't quite as sure. I knew that I was sure. I think it's important to send a message. I think it's important to set an example and to show my trust in science and this health system and our leaders and in everybody for all the work that they have done to make sure this was safe and effective for all of us. For all intents and purposes, it's what an ICU is supposed to be. However, what we're feeling right now is what an ICU typically is on its worst day. But instead of those being one-off, really bad, really hard, heavy days, those are now every day. I feel great with the shot, yeah. It's so many emotions, and it feels surreal, and you're excited, and you're hopeful, and it's like a little bit of joy for the first time in a long time.
My chair asked me today if I'd be willing to get it, and I've been looking forward to this moment for 9 months now, and so I'm thrilled that I was able to come in and get it. It felt not quite as bad as a flu shot or a tetanus shot. It was quick and fairly painless. I felt fine afterwards. I feel fine 15 minutes after also. So COVID patients are kind of sprinkled in with all of the other patients that we're seeing. So it kind of adds a level of complexity to be able to prepare ourselves for patients possibly being COVID positive, even though they were in with a car accident or fell and broke their hip. They can also be COVID positive as well. So it really adds some extra wrinkles into our day-to-day activities in the ER. They can come in and be completely asymptomatic. Maybe they were in a car accident and we accidentally, discovered they have COVID as well. Or they could be minimally symptomatic, just some viral symptoms, and they're able to go home. Or they could be very extremely ill and need to go to the ICU, intubated, on all sorts of oxygen requirements. And so it's just a really interesting disease process that has been a challenge to treat. The therapies that we have for them have evolved over the last several months, and so it's difficult to kind of manage them in person as well as keep up with the best management strategies for them. I got the shot for my wife, who's a general pediatrician, and I got the shot today for my kids, so that this can be the next step in our family's process of protecting them from, the exposure that I bring home every day, but also kind of as we start to move towards getting more whole as a society. It's definitely stuff that we've had to plan for, and then I've had exposures at work that I have had to kind of separate myself from my family, stay camped out in the basement, and stuff like that. So I've had 2 or 3 quarantines during this process as well, where I've just tried to minimize my exposure to them. So yeah. Well, for me, it's not just a shot of, the immunization. It's also a shot of adrenaline. It kind of gives us like extra momentum to kind of go through and kind of keep battling this. That hopefully this is the next step in things getting better for our community and for our country.
It's exciting. I was very honored that I was picked to be one of the first 5 to receive the vaccine. It was a very easy decision. Any way I can help in the name of science to help get rid of this pandemic. So Unit 15 used to be a cystic fibrosis floor. When COVID hit in March, we became like the ICU step down or acute care unit, where we would take patients before they would need the ICU level of care with COVID. It was really sad to say goodbye to our CF patients, but they are so immunocompromised they needed to relocate. We haven't been able to see them since March, so it's been a little tough, but we've all been hanging in there and now kind of consider ourselves COVID experts. I know that they try to at least take a group of patients and put them together. Some patients that require a specific medication that nurses are experts with, they will send a float-in nurse to that new unit in order to make sure that we're taking best care of our patients. We sent PEDS some stuff on how to take care of our CFers, and they've kept in touch with us and given us, donated like flowers and snacks to the unit. It's been really wonderful. I took the vaccine for my coworkers who I've watched. I don't live with my family, but I watched them have to sleep away from their families and make adjustments to that. We have some of the hardest working nurses on Unit 15 that have really been pulling up their bootstraps and working through this pandemic, no hesitation. We've switched our unit around several times and no one's ever hesitated, or everyone's just been like, okay, what are we doing next? It means hope. That there's an end in sight, that if we can start doing this, we can get some of our numbers down and then hopefully get rid of COVID altogether. I feel fine. The flu shot was worse.
For me, it was a great opportunity. I really didn't see any reason why not to. I think it's a sort of a good chance for me to contribute in some way to sort of at least slowing or potentially maybe even one day stopping the spread of this virus. So it was an honor for me. Well, obviously, like the most immediately emotionally significant people for me would be my close family and friends. But really, it's for them, but also my entire community and potentially the entire world. Because again, I feel like it's perhaps in a way I'm trying to contribute to slowing the spread or stopping the spread of the virus. So, well, first of all, they're extremely sick, particularly on the units that I work. 90% of my time I spend on 6th floor, which is where we have our ICU acuity COVID patients. We've had dozens of them up there, and most of whom are in critical condition. They vary in that they all present with a profound hypoxia and really troubles ventilating and breathing in general. Obviously, we have plenty of respiratory failure up there from other causes, but this one is unique in that we have had to intervene with things like proning, with extremely dangerously high pressures on our ventilator settings that go far beyond a typical respiratory failure patient. So this is not anything that I've really seen consistently ever before. Granted, I've only been here a year or so, but still. unfortunately, a lot of the time we don't have any choice. This virus causes a really, really severe compromise of gas exchange in the lungs. And so in order to overcome that, unfortunately, we have to compensate with incredibly, really, really, really high oxygen flow, high oxygen concentrations, but also really, really high pressures from the ventilator itself. Well, it gets tiresome for sure. You know, I'm really tired of seeing these patients come in, quite frankly. Obviously, I'll do everything I can for them. I'm happy to. I'm proud to. I like what I do, so I'm going to do everything I can for them. And I'll try to comfort them the best I can the whole way. But yeah, definitely pretty tiresome. I would really, really like to see it slow down or potentially stop. For a while there, I was really hopeful that maybe it was, but unfortunately, we've picked right back up again, and we're even busier than we were at the start of this. So. Feels great. I mean, yeah, I'm honored. I'm glad that I could be a part of it. I just really hope that this one takes off and shows a lot of promise and ends up working well. Because again, I really want this to work so that I can actually feel safer around my family and friends and anybody else in my community. So. You know, I think people's concerns are absolutely valid. I'm not going to shoot down anybody that says they're not comfortable getting this. This was my own personal choice.
Are you Mary Ann?
Hi.
I'm Adam.
Yes.
I'm going to give you your vaccine, okay?
Okay,
Sound
Adam.
good? We're going to go
Sounds
right
good.
through here. Okay?
All right.
And we're going to go right back here to room 3.
Okay.
All right.
Sit here.
Okay. Yep. Okay. You're going to feel a stick and a burn, okay?
Okay.
Okay, 1, 2, 3. And you are good to go.
Thank you, Adam.
And I'm going to have you put your hand right over that. Okay. Go ahead and lift your finger up. All right, we're going to have you go to... And we're going to have you go right down here. Yep, right in there. Okay. You got the vaccine.
Thank you, Adam.
Did you mark on there that not only did she get the vaccine, but she got the first one?
Did you mark that?
I haven't, but I can't. I absolutely can.
I think we should put that out there.
Put everything on there that I need. Yes.
Yeah, you should have. Yep.
Number one.
You have it in your email as well as on that card.
Okay.
All of it. Yep.
All right.
Yeah.
Well, thank you.
Of course.
Thank
you
you.
guys. I appreciate it.
Thank
Well,
you.
and thanks for this team. I'll tell
Yeah.
you, this team did a pretty remarkable job getting this vaccination clinic up and going so quickly.
Yes. Yes, they have. Thank
think
you
they
so
have.
much.
Looks like you just built this. This is pretty impressive, you guys.
You can go right out into the lobby, Mary Ann, this way.
Oh,
Is that what you want?
yes.
Come on up.
Oh, thank you.
Sorry.
Thank you,
I
guys.
didn't mean to leave you hanging.
All right, thank you so much.
Okay, and Jill's gonna ask you some questions if you don't mind. Just a couple, I think she's not. Adam, are you ready for your next
I
patient?
am.
All
Come
right.
on in,
Hi.
Chrissy. How are you?
I'm so good. How are you?
Good. Okay, where are we giving this at? Which
Left arm? I'm smiling with my eyes. You all just can't tell.
You're smizing. Tension and burn, okay? 1, 2, 3. Okay, cotton ball.
Yep.
Okay, we're gonna go right into room 3 here. And you're gonna sit right here. Over here. All right. Okay. Okay. Stick and a burn. 1, 2, 3.
Awesome.
What you feeling right now?
Feel great.
I'll have you put
I'm
your
excited.
finger right on that.
Yeah.
Information in your email as well. I'm going to have you move down to one of our monitoring rooms.
Okay.
So Anna will get you in a monitoring room and get you scheduled for your second dose.
How you doing?
Thank you. Okay. And Genevieve, which arm do you want it in?
Off to the left.
Okay. I should really just
There
put
is
my
my
back.
spray can.
Yeah. Okay. All right. Ready?
Mm-hmm.
Okay. Stick it over. Now go and put your finger right on there. Perfect. All right. Okay. Relax your arms as much as you can. Yep. Okay. Ready? Mm-hmm. Yes, stick and burn. 1, 2, 3. Your muscle did not like me sticking that needle in.
It's very reactive.
Huh.
Did it take?
Yep.
Good.
Yep.
Didn't screw anything.
No, it did not at all. It just twitched as soon as I
Nice.
as soon as I put it in. So go ahead and have you put your finger over there.
Sure. Yep.
All right, you are good to go, my friend.
Very well.
Here is your administration record card.
Great.
Hold on to that.
Okay.
You will also get all of this information in your email inbox.
Okay.